sir.
Radul Kumar Roy and your team
Thank
of
you.
the Pharmed Limited, one of the well-known company dealing with orthopedics and trauma. Anyway, I'm seeing this particular bone model of fracture of the major bones, femur and humerus and tibia and all that. But as a doctor, I would like to say for the common people that whenever a person met an accident on the road or at home or small fall at home, all these things can produce fractures. So I would define two things. One is a major high energy fracture where you meet, young people, healthy people meeting very high energy accident and falling from a height or meeting a very high speed accident, etc. Then they can have major fractures of the long bones like thigh bone, arm, leg bone, etc., etc. But another group of people where our Indian population is increasing in size in terms of age, especially geriatric population, they differ from the type of fractures we encounter in day-to-day life. They do have a small domestic, trips, domestic falls. They suffer from fragility fractures, which we call it as osteoporotic bone fractures. Therefore, the treatment protocol for these two groups are slightly different. Nevertheless, having said so, for the fracture of these major bones, immediately, if the person is either on the roadside or at home, wherever it is, you must first immediately look the person's condition first, whether it is active bleeding or not. Whether if there is active bleeding, you must make sure the bleeding is stopped by putting some pressure bandage, by whatever available means. Then you immobilize with splinters. Use any splint. If it is available, a board, a cardboard, tie it up so that the leg is not mobilized. But never try to twist and never try to pull because it might injure the nerve and blood vessels, which are already critically nearby the fracture site. Therefore, these are the small precautions. And take him or immediately summon the emergency ambulance, or if he's nearby to a hospital, take him to a nearby hospital. And the necessary things will definitely be taken care of. What I am trying to emphasize is common major fractures when we encounter pre-hospital situation, how you manage. When it goes to the hospital, then definitely you have the establishment, do the X-ray, XYZ, and the normal procedure of treatment, including conservative treatment, including surgery, whatever is taken care of. This is one way of looking at it. On the other spectrum about the osteoporotic fractures, they do suffer for those individuals who are of elderly group, 60 plus, having other associated cardiovascular problem, lung problem, etc., etc. You must make sure that they have been taken care of side by side. Because just because the simple fracture of collis fracture, fracture neck femur, or spine fracture is not going to die, but associated problems with a shock may endanger the very, very life. Therefore, you need to give them a proper precaution while taking care of this. And especially for fracture neck femur, an elderly person, you cannot treat them at home. First, take them to the hospital under proper conditions. If it is a spine injury or spine fracture without any neurological complications, well, he can be or she can be lifted or taken to the hospital, or even domiciliary treatment can be managed. Anyway, if there's a fractured collis, because there are three important fractures in the elderly group, there's a collis fracture, second is the spine, the third, most critical, most prognostically bad fracture is fracture neck femur. So accordingly, you take care of them. So this is how I would say for the consumption to the general public.